So, when you break your arm, there's this, I don't know, this strange kind of comfort in getting an X-ray.
Oh, totally. Because it's visible.
Right.
Yeah.
You get this black and white image, you see the jagged little line right across the bone, and the doctor just points at it and says, there it is.
Yeah, it's completely binary. It's broken.
Exactly. And society knows exactly what to do with a broken arm. You get a cast, your friends sign it, people hold doors open for you.
Right. Because the injury is visible, the support is just automatic.
Mhm.
I mean, we are incredibly good at categorizing physical trauma. We have a whole established script for it.
We really do. But when you step into the world of infertility, that X-ray machine is entirely useless.
Yeah, completely useless.
You're navigating this profound loss, but there's no cast, there are no signatures. You're basically walking around with an invisible fracture.
That's a really good way to put it.
Thanks. So welcome to today's deep dive. We are jumping into a world that society almost exclusively treats as just a medical hurdle. We always hear about the statistics, the clinical procedures, the timelines.
Right, the clinical side is all anyone really talks about.
Exactly. But our mission for you, listening right now, is to look completely past that clinical data. We're going under the hood to examine the massive hidden impact on a person's inner life.
Yeah, the emotion reality of it.
Right. And we've been looking at some really fascinating clinical frameworks and service models from coping and healing counseling, which, by the way, is a telehealth therapy practice based out of Georgia.
Mhm.
And they use a term in the sources that it just completely reframes this entire experience.
Yeah, the term is disenfranchised grief.
Yeah.
And it is really the core psychological theme we need to unpack today.
It's such a powerful phrase.
It really is.
Yeah.
Understanding this framework challenges you to completely rethink the mechanics of loss. It forces us to look at what happens to the human psyche when a profound trauma occurs, but society simply refuses to give you permission to mourn it.
I want to spend some time on that lack of permission, actually, because the reality described in the sources is just staggering.
It's intense, yeah.
To understand the internal reality of infertility, we kind of have to look at how society completely misses the mark externally. I mean, when a visible traditional loss happens, say the passing of a relative, the script kicks in, right?
Oh, absolutely. The social script is immediate.
Right. There's a funeral, a neighbor shows up at your front door with a baked ziti, you get sympathy cards in the mail, and, HR gives you bereavement leave.
And those traditional rituals, they serve a deeply vital psychological function.
Yeah.
They are not just polite gestures.
Right. They mean something more.
Exactly. When a neighbor brings a casserole, they are essentially validating the person's pain. They're looking at the grieving individual and saying, we see that you are hurting, your hurt is justified, and you are allowed to pause your life to process this.
And infertility operates completely in a void of that validation. There is no funeral for a failed IVF cycle.
No, not at all.
Nobody brings you a casserole when the ultrasound shows no heartbeat. The sources detail these just agonizing, invisible moments that make up the day-to-day reality of this.
Yeah, the daily burden is immense.
It really is. I mean, you have these brutal 2-week waits between an embryo transfer and a pregnancy test, where a person is just hyper-analyzing every single twitch or sensation in their body.
Right, every little thing becomes a sign.
Yes, and you have people hiding daily medical appointments around a work schedule, telling their boss they had a flat tire or a dentist appointment just to cover it up.
And the cognitive dissonance of having to lie about a flat tire while you are undergoing these highly invasive, emotionally fraught medical interventions, it actually accelerates the psychological burnout.
Oh, I bet.
Yeah, because you are carrying this massive secret while desperately trying to perform normalcy for everyone around you.
It's like being forced to live in a house while it is actively under construction, but no one else around you can hear the jackhammers.
That is exactly what it feels like.
And then out of nowhere, you get the group chat text.
Oh, the unannounced ultrasound photo.
Yes. You're just sitting at your desk, eating a sandwich, your phone buzzes, and a friend from college drops an ultrasound photo with absolutely no warning.
Like a jump scare.
Literally.
Oh.
Suddenly, you are socially obligated to reply with party popper emojis and exclamation points, while internally you are completely spiraling. It's this incredibly messy, visceral reality.
And the guilt that follows that reaction is so heavy.
Right, because you might even feel this sudden, irrational anger at your friend, followed instantly by just overwhelming guilt for being angry.
And that messy, layered reaction is exactly the defining feature of disenfranchised grief.
Okay, so let's break that down a bit more.
Sure. So in clinical psychology, disenfranchised grief refers specifically to a loss that a person does not feel entitled to name publicly.
Because there's no social category for it.
Exactly. Because society doesn't recognize an unconceived child or, a plunging hormone level with a formal mourning period, the individual actually starts to gaslight themselves.
Wow, so they turn it inward.
Right. They internalize the idea that their grief isn't real. But the psychological toll is measurable, and it is immense. The data in our sources makes a very clear point. Struggling with this is definitively not a sign of emotional fragility.
That part was a massive wake-up call for me. We aren't just talking about mild disappointment here, right? Like the distress levels are off the charts.
They really are. Studies of individuals navigating infertility reveal distress levels that are comparable to patients dealing with cancer or heart disease.
Wait, really? Heart disease?
Yes. The anxiety, the clinical depression, the profound sense of physical betrayal, it operates at the exact same level of severity as a life-threatening illness diagnosis.
That is wild.
It is. Yet, because of the disenfranchisement, they are expected to answer emails, attend baby showers,
Yeah.
and just carry on as if nothing is happening.
Which, that brings up a cliche that I hear constantly, and I really want to push back on it here. We always hear the phrase, time heals all wounds.
Ugh, yes, the default comfort phrase.
Right. It is the default comfort phrase for grief. But in the context of infertility, time is actually the enemy, isn't it?
It absolutely is.
Because standard grief follows a curve where time softens the blow, but this grief doesn't work that way at all.
Right. Standard grief is linear. You experience a devastating loss, and while you never truly forget it, the intensity of the acute pain generally eases as you adapt to the new reality over months and years.
Mhm.
But infertility presents a distinctive distress profile because it is cyclical.
It resets every single month.
Exactly. Every 28 days, roughly. There is this huge buildup of hope, followed by a waiting period, and then a crash of profound loss.
And then it just starts all over again.
Right. The calendar turns, and the biological cycle demands that you immediately summon the emotional hope and the physical stamina to do it all over again.
So if society tells you that time is supposed to heal you, but every month the clock resets and you're right back crying on the bathroom floor, you're going to think you're failing at grieving.
That's the tragic part. People begin to interpret their lack of emotional improvement as a personal shortcoming.
They think they should be stronger.
Yes, but they physically cannot heal because the wound is literally being reopened every 4 weeks.
Man. And the physical toll of that loop leads to a concept in the sources that I found absolutely heartbreaking. The feeling that your body has become a project instead of a home.
That dissociation is a protective mechanism, but it's an incredibly taxing one.
I can't even imagine.
Your body, which is supposed to be your sanctuary, suddenly becomes this highly medicalized, heavily monitored environment. You stop inhabiting your physical self and start managing it like a failing science experiment.
Right, you're just tracking data at that point.
Exactly. You are tracking basal temperatures, administering injections, and constantly mapping out ovulation timelines.
Managing that project must require an unbelievable amount of cognitive load. I mean, I can't even imagine the decision fatigue involved.
The decision fatigue is what wears down the psyche just as much as the sadness itself.
Hmm.
It's not just the emotional resetting, it's the constant high-stakes choices.
Like what kind of choices?
Well, if someone is in active treatment, they're deciding on complex medication protocols and massive financial investments.
Oh, right, the money aspect is huge.
Huge.
Yeah.
And if they're between rounds, they are agonizing over whether their body needs physical rest versus, the ticking clock of their biological timeline.
It's a completely impossible balancing act.
It really is. Or perhaps the heaviest decision of all, trying to navigate the choice of whether to keep going or to finally stop trying entirely.
And none of this happens in a vacuum. You mentioned earlier that the grief resets every month.
Right.
So if I am coping with that reset by researching every new treatment protocol on Reddit at 2 a.m., but my partner is coping by shutting down and refusing to talk about it because it hurts too much, those monthly resets must turn into emotional landmines for a relationship.
Oh, they absolutely do.
The sources talk extensively about this collateral damage spilling over into partnerships. But actually, I have a genuine point of confusion here that maybe you can clear up.
Sure, what is it?
The sources emphasize that partners are often on completely different timelines in their grief. I don't fully get that. If they are living in the same house, going to the same appointments, and getting the same negative test results on the exact same day, how are they experiencing the timeline differently?
That is the really insidious nature of how crisis exposes different coping
Mhm.
mechanisms. They are experiencing the same objective event, sure, but their emotional processing speeds and their limits are completely different.
Ah, I see.
You might have one partner who is a processor. They want to talk about it constantly. They want to try another clinic. They feel this absolute imperative to do one more round of IVF.
They need to act on it.
Exactly.
Good.
But the other partner might be a fixer or an avoider.
Yeah.
They might be emotionally and financially tapped out, ready to pull the plug on treatments, and maybe explore adoption or a life without children.
Ah. So they are physically sitting on the same couch, but emotionally they are months or even years apart in their acceptance of the situation.
Precisely. And without intervention, that gap only widens. One partner feels abandoned because the other won't talk about it.
And the other probably feels overwhelmed.
Yes, the other partner feels suffocated because they are constantly being forced to dwell on the pain. The relationship can easily buckle under the weight of that cyclical grief.
Which I guess is why the sources point towards specific therapy.
Right, which is precisely why the clinical consensus often points to couples therapy being more appropriate than just individual therapy for this specific issue. You have to bridge that timeline gap before the resentment becomes permanent.
But the collateral damage doesn't just stop at the partner, it fractures friendships too. We touched on the group chat ultrasound photo earlier, but the social fallout seems like one of the most isolating parts of this whole journey.
The isolation is often self-imposed, actually,
Yeah.
but out of absolute necessity.
What do you mean?
Well, you are stuck in this relentless monthly loop of loss while your peers seem to be effortlessly moving forward. They are having baby showers, celebrating first birthdays, complaining about sleepless nights.
And there is this incredibly complex, ugly guilt that comes with feeling deeply, profoundly jealous when someone you genuinely love is happy.
It's a very painful contradiction.
It really is. You want to be thrilled for your sister's pregnancy, but her joy basically acts as a glaring, inescapable spotlight on your own invisible loss. So, to protect yourself, you withdraw. You decline the baby shower invitations, you mute the group chats, you skip the holiday parties.
And by withdrawing to protect their mental health,
hmm
they end up losing their primary support system right when they are experiencing distress levels akin to a major medical diagnosis.
They're just completely stranded.
Exactly.
Okay, so let's look at the full picture of what someone is carrying here. You have an incredibly heavy, disenfranchised grief that society refuses to validate.
Right.
You have a body that feels like a science project. You have severe decision fatigue from managing medical and financial choices. You have friends you can't relate to without feeling crippling guilt, and a romantic relationship that is buckling under the pressure of mismatched grieving timelines.
Is a staggering amount of weight to carry.
People need a safe space to finally set this down. Which brings us back to coping and healing counseling, the practice we mentioned at the top of the deep dive.
Yes. Having a dedicated professional environment to untangle this level of relational strain is so critical. But, the delivery mechanism of that care matters just as much as the therapy itself.
And that's where the logistics of how CHC operates actually serve as part of the solution. Let's not just read down their list of services. Let's really look at why they are set up this way.
I think that's a great approach.
First off, they are a 100% telehealth, high PA compliant practice, serving all 159 counties in Georgia.
That statewide reach is huge.
It is. If you live in a major city, maybe a clinic is down the street. But if you live in rural Georgia, your nearest fertility specialist might be a 2-hour drive away.
Right. And by the time an individual manages the commute, the waiting room anxiety, and the medical trauma of the appointment itself, their emotional reserves are entirely depleted.
They have nothing left for therapy.
Exactly. Telehealth in this context isn't merely a perk or like a modern convenience. It is a vital clinical tool. It removes the physical friction of accessing mental health care.
You don't have to get back in a car, fight traffic, and sit in yet another sterile waiting room holding a clipboard.
No one wants to hold another clipboard.
No. You can sit on your own couch, wrapped in your own blanket, and talk to a professional. It basically takes the therapy out of the clinical environment and puts it back into the home that has felt so medically compromised.
That's a beautiful way to phrase it.
And CHC has a diverse, culturally competent team of over 15 licensed therapists. They utilize licensed clinical social workers, licensed professional counselors, and licensed marriage and family therapists.
And that variety is really intentional.
Yeah, they handle individual, couples, teen therapy for ages 13 and up, and family therapy.
The variety of therapeutic licenses means they have an ecosystem of care designed to address the specific, messy realities we just discussed.
Right, they have the right tools for the job.
Exactly. A marriage and family therapist, for example, is specifically trained to look at the dynamic between the partners, that widening gap in their grieving timelines, rather than just treating the individuals in a silo.
That makes so much sense.
And acknowledging family and teen therapy is crucial too, because infertility and the stress of family building inevitably ripples out, impacting older siblings or the broader family unit.
And, you know, they treat a wide range of issues beyond infertility distress to anxiety, depression, trauma and PTSD, general grief, relationship issues, and stress.
It's very comprehensive.
It is, but I really want to talk about the financial side of this because we discussed decision fatigue earlier.
Yes, the financial burden is massive.
If you are already bleeding money on out-of-pocket fertility treatments, deciding to spend hundreds of dollars a week on therapy feels like a luxury you simply cannot afford. It becomes just another massive hurdle.
Financial strain is one of the most prominent accelerants of infertility distress. Removing the financial barrier to mental health support can immediately de-escalate some of that cognitive load.
And that is exactly what CHC's model does. For Medicaid patients in Georgia, sessions have a $0 copay.
Wow.
Zero. That alone is a massive lifeline. And for most commercial insurance plans, they accept Aetna, Cigna, Blue Cross Blue Shield, United Healthcare, Humana sessions run anywhere from just $10 to $40.
That is incredibly accessible.
They're making getting help virtually frictionless. I mean, if you are exhausted by the financial calculus of IVF, you don't have to do complex math to afford a space to talk about it.
When you remove the commute, eliminate the waiting room, and drastically lower the financial barrier, you create a pathway where the patient can actually focus on the psychological work.
They can just show up and heal.
Exactly. The clinician can help them process the disenfranchised grief, guide partners back onto the same emotional timeline, and shoulder some of that overwhelming decision fatigue.
If anyone in Georgia listening needs to tap into this resource and connect with their team, the logistics are pretty straightforward.
Go ahead.
You can reach them at 404-832-0102, check out their clinicians and services at chextherapy.com, or email them at support@chextherapy.com. It is a tangible way to stop carrying that invisible weight alone.
And it provides the validation that society often fails to offer. It basically says, your pain is real, and it is entirely valid to need support for it.
So as we pull all these threads together today, the main takeaway for you listening is hopefully crystal clear. Infertility is not just a medical timeline. It is not just an X-ray or a lab result.
Not at all.
It is a profound, cyclical, messy emotional journey that completely rewires a person's inner life and their closest relationships. It is a heavy, valid grief that deserves to be spoken out loud and supported, regardless of whether society has written a convenient script for it yet.
It demands that we look far beyond the visible markers of physical injury and challenge ourselves to offer grace for the invisible, grinding battles people are fighting beneath the surface every single day.
And that leads to a final thought I want to leave you with, something to mull over on your commute or, the next time you were sitting in a meeting.
I love this part.
If the profound, isolating pain of infertility stems, at least in part, from a lack of societal rituals, because there are no casseroles or bereavement leave policies to acknowledge the loss, what other invisible, disenfranchised losses are you, or the person sitting right next to you, carrying every single day, simply because society hasn't invented a greeting card for them yet?
Wow. It is a lens that fundamentally shifts how you interact with your community.
It really does. The next time a coworker tells you they're just running out to the dentist or taking care of a flat tire, remember they might actually be carrying the weight of the world. Thank you for joining us for this deep dive today, and as always, keep looking beneath the surface.